Greetings to those of us who have joined us for this symposium as we take a critical look at the mental health of Black Americans before and after the death of George Floyd. My name is Dr. Crystal Herbert, and I serve as the Vice President of Clinical Affairs at Hurdle, a culturally intentional teletherapy organization that utilizes evidence-based methods of cultural humility and cultural mindfulness to deliver responsive mental health services to all people, with a particular focus on the Black community and other minorities. As we prepare to begin our event, and as questions come up for you, please feel free to include them in the chat section, and they will be addressed during the Q&A, which will occur during the final 10 minutes of the event. And with that, it is my sincere pleasure to introduce you to Daniel H. Gillison, Jr., the Chief Executive Officer of the National Alliance on Mental Illness. Dan joined NAMI with a wealth of expertise in health and human services, justice, and public safety, having previously led both the American Psychiatric Association Foundation, as well as County Solutions and Innovation for the National Association of Counties. Without further ado, and with great esteem, welcome Mr. Dan Gillison, Jr., who is serving as our moderator for today's event.
Thank you very much, Crystal. It's my pleasure to be here and to be with everyone on today. I would like to take this opportunity to introduce our esteemed guest, Dr. David Satcher and former Congressman Patrick Kennedy. During his time in Congress, Patrick J. Kennedy was the lead author of the landmark Mental Health Parity and Addiction Equity Act, which requires insurers to cover treatment for mental health and substance use disorders no more restrictively than treatment for illnesses of the body. As founder of the Kennedy Forum, he now unites advocates, business leaders, and government agencies to advance evidence-based practices and policies in mental health and addiction. Thank you, Congressman Kennedy, for being here today. Now, Dr. David Satcher is a physician scientist and public health administrator. Dr. Satcher served as the 16th Surgeon General of the United States. He has also served as the director of the CDC. Dr. Satcher has also held top leadership positions at multiple schools of medicine and has received over 50 honorary degrees and numerous awards from diverse organizations and agencies. Currently, Dr. Satcher is the founding director and senior advisor for the Satcher Health Leadership Institute at the Morehouse School of Medicine, Atlanta, Georgia. Thank you, Dr. Satcher, for being here as well. Dr. Satcher, we'd like to give you the opportunity to introduce yourself and talk about the importance of why we are here today.
Well, thank you, Dan. I'm delighted to be here with this very distinguished group. And I think it was around 1999, 2000, that we released the first ever Surgeon General's report on mental health. And we were very fortunate. You've introduced Patrick Kennedy, and one of the best things that could have happened to us was to have him in Congress, during this period of time. His father was also in Congress, but Patrick really led in getting Congress to realize the importance of mental health. And as you pointed out, mental health parity and addiction equity legislation came out of his efforts. I was very pleased to be able to work with him and others to put together the Surgeon General's report on mental health. And I really think that people were ready for that report. I mean, there are some reports from the Office of the Surgeon General that people are not quite ready for, but I think people realized what was happening to us in society, and therefore were ready for this report. And the same thing is true today, I think, with the Floyd's death and all that we've been through since then and around that. We're ready to take another major step forward, I think, in terms of mental health care, mental health equity.
Thank you. Congressman Kennedy, is there anything else you'd like to add to Dr. Satcher's comments?
Thanks, Dan. I just say how honored I am to have worked with Dr. Satcher. Dr. Satcher was really a pioneer in all forms of civil rights struggles, and in fact was jailed with Dr. King. And to see him today still fighting the fight for social justice is such an inspiration. I recall that the history books talked about him. They talked about how my uncle, President Kennedy, in the signing the first address nationally on civil rights, remarked that who amongst us would be willing to change the color of their skin and be content with those who counsel patience and delay. And of course, what do we face today is that same inertia. And if you trade places, which is the golden rule, with others and really imagine what it is to walk in their shoes, how tolerant would you be with a reluctance of our status quo to make those changes that really led people like Dr. Satcher over 60 years ago to go to jail for civil rights, voting rights, fair housing, fair employment. Now we're at a new point of inflection to really ensure that that expansion of opportunity and equity exists in mental health, and also to acknowledge through the participants on this call the real impact of systemic injustice and racial prejudice fight both directly and vicariously on our brothers and sisters in this country simply because they color their skin. So I'm excited to be part of this very historic panel, and thank you, Dan, for your leadership as well.
Thank you. It's so good to be with both of you all today, and part of Dr. Satcher's work as he talks about the quest for health equity. He talks about leadership and learning. So we're going to do both today. We are talking about leadership right now in terms of the work of Patrick Kennedy, the work of Dr. Satcher. Now we're going to transition into some learning. And with that, I'd like to introduce the authors of the George Floyd report, Dr. Norma Day Vines and Dr. Harold Neighbors. Dr. Norma Day Vines serves as the Associate Dean for Faculty Development in the School of Education at Johns Hopkins University and maintains a faculty appointment as Professor of Counseling and Educational Studies. She has published widely on counseling strategies for working more effectively with culturally and linguistically diverse children and adolescents, with a special emphasis on African-American youngsters. At Hurdle, she develops assessment tools for therapists and clients and advises on clinical matters. Thank you, Dr. Day Vines, for being here with us today. Dr. Neighbors specializes in difficult to reach populations and has spent his career studying racial, ethnic, and gender disparities in help-seeking behavior for emotional problems. Dr. Neighbors also studies hope, discouragement, and social mobility as mechanisms connecting race and racism to health disparities. He is currently Professor Emeritus at the University of Michigan School of Public Health. Thank you, Dr. Neighbors, for being here with us today as well. Dr. Day Vines, could you speak more about the paper you co-authored with Dr. Neighbors?
Yeah, so the paper was an opportunity to sort of think about the 1-year anniversary of George Floyd's death and to think about it in the context of mental health and mental health needs. It was a call to action because in the aftermath of Floyd's death, many corporations expressed their solidarity with the African-American community. And on this 1-year anniversary through Hurdle and the work of Ken Lipton, there is an effort to hold these accountable in terms of giving back to the African-American community around issues related to mental health. I would just also add that the paper talks about mental health issues in an historical context. It sort of describes how African-Americans have been perceived. It talks about George Floyd and police brutality and about Hurdle's model for counseling and cultural competence.
Thank you very much. Dr. Neighbors, would you like to add to those comments?
Yes, I would. Thank you, Dan, and thanks for the introduction. I want to say good afternoon to all the panelists as well as to the audience out there, and say what a real honor it is to be part of such an esteemed panel. I wish I could say it was a complete pleasure to write this paper with Dr. Dave Vines, but it wasn't always a pleasure. You know, all of us, and I know she will agree with me, that parts of this paper were really tough to write because of the situation. And so when Kevin handed this opportunity to us, the first thing that came to my mind was, if Black lives matter, then Black deaths matter as well. And there are far, far too many unnecessary excess Black deaths. So the way we thought about this is that the death of George Floyd should never have happened. And that's emblematic of so many deaths of Black people that never should have happened. But this is a time for optimism, and this is a call for action and a call for change. So we worked through some of those difficulties, and I think ended in an uplifting way, an encouraging way. And so my take on this whole situation is that almost everything we do is related to mental health. Mental health is a right, not a privilege. And we're looking for change. And so that's why I think this paper is a good one, because it's a call for action. And I look back over the years that I've been doing research on this, and I come away saying I have good news and bad news. And I'm looking forward today, over the course of this conversation, to share a little bit of both with all of you and with the audience.
Well, thank you. We look forward to you sharing. And as I speak as the CEO of NAMI, I also speak and really honored to be here as a father and an uncle who is concerned on a daily basis. So thank you for your body of work and for this discussion today. And as we go into the questions, I'm looking forward to learning as well. So let me start out at the top of our discussion today. We felt it was important to take a few minutes to level set on some terminology, specifically what we mean when we say systematic racism. In his book, How to Be an Anti-Racist, author Ibram X. Kendi defines racism as the marriage of racist policies and racist ideas that produces and normalizes racial inequities. And racial inequity is defined as when two or more racial groups are not standing on equal footing. Pulling from these definitions, how have racist policies and racist ideas produced and normalized racial inequities and mental health? And that question is for Dr. Dave Vines and Dr. Neighbors.
So one of the things I would say, historically, African Americans were not seen as suitable candidates for counseling. They were seen as simple, uncomplicated people who couldn't profit from any form of counseling, and so they were excluded. And I think it's important to remember that our sort of founding fathers in counseling and mental health and psychology and psychiatry sort of emerged in the early 20th century. But African civilizations existed, thousands of years. So prior to, the emergence of Freud and Jung and Adler, African civilizations were flourishing, and mental health needs were met in different ways. They were met through family members. They were met through extended family members, met through the elders. They were religion and spirituality. And so in that context, the traditional mental health care that we think of were not designed for African Americans and all not meet their needs, and especially since they weren't considered as having the intellect to profit from counseling. And so we still see some of these systemic kinds of concerns in the mental health profession today. 30% of all counseling sessions prematurely, but on average, 50% of ethnic minority sessions with ethnic minority clients and scholars attribute that to racism and discrimination, communication, sort of the contempt and sort of the lack of concern for African American clients. So when we we straight line between the past and the present in terms of how many African American treated in the health realm.
Thank you, Dr. Dave Vines. Dr. Neighbors?
Yes, it's a great question, but it's a tough question. When I heard that question from you, the first thing that came to my mind was to make sure everybody understands that health equity, and in this case, mental health equity, still remains a future vision for us. It's an ideal toward which we are still working, but it doesn't exist. The reality is one of inequity, and I just think we should never forget that. The second thing that comes to mind, when I listen to your question is how difficult it can be sometimes to talk about racism and actually call it out, particularly in multiracial contexts. So things like systemic racism or structural racism can sometimes sound a little vague to people. And at other times, people are too quick, I think, to personalize those words. And they actually hear you calling them racist. So I think it's very important for all of us to be just a little bit more clear and precise in what we mean by these words. So the way I like to think about this is that racism is based on a flawed mythological premise that because of the way we look, some groups of different colors are superior to other groups. So for me, that fundamentally defines racism. Now, that idea over the history of our country has permeated our institutions and our organizations. And there are indeed people out there who hold this point of view, but the concept of racism has contributed to the development of racial discrimination and issues of implicit bias. And so these are other things that we really need to be on the lookout for. So we need to find a language that will allow us to talk to each other about the policy and the implementation of racism over the life of our country, while at the same time understanding that there are current situations that still privilege certain groups, but it doesn't necessarily mean that everyone is a racist. I think the policies need to be changed, and the way we see the visible implication of those policies is certainly in mental health with respect to the racial disparities in the workforce, and also some of the disparities we see in the diagnosis of people of color who get into treatment. And in my opinion, that's where implicit bias really takes hold. So I hope we'll have an opportunity to discuss and debate some of those ideas as well.
We definitely will, and thank you very much. I think that we'd love to get back to the flawed mythological premise and what Patrick opened with is walking in someone else's shoes, all the way to what you just offered in terms of when you're discussing race and people personalize it and they think you're talking about them. So what is that language we should use? And I think that also going to the policies, it's about coming back to leadership, which leads us into the next question, Dr. Satcher and Congressman Kennedy. George Floyd's murder and the social justice movement that emerged from the tragedy that has created a watershed moment in America's understanding of mental health and illness. So that's the premise. Do you believe this understanding takes into account the particulars of what's needed to address the unique experiences of Black Americans and other disenfranchised communities? Dr. Satcher, Congressman Kennedy.
Well, I guess the answer to the question is no, but that's not enough of an answer. I think racism is an interesting phenomenon. I date my experience with racism back to when I was 4 years old, and I had saved money because I wanted to buy an ice cream cone. So I went to town with my brothers, and when they looked the other way, I sneaked into the store and asked for an ice cream cone. And the lady behind the counter said, "We don't serve the N-word here." She basically was talking about a policy that said that they didn't serve African Americans because of our race, because of our color. That was sort of the beginning. Now, obviously, coming to understand racism gets very complicated along the way. But I think the thing about the student movement, if I could jump to that, when I was at Morehouse, was that we chose the time and the place that we were going to go to jail. We knew what the rules were, and we decided that we were going to break them. And I think it was this control, saying that we're going to decide when and where we're going to be arrested, because we know that they're wrong. We know that they have these policies and attitudes. And on one occasion, we even said that we were going to fill the jails. So the students from Spelman and Clark and Morehouse and Morris Brown all turned out, and we did fill the jails. I was by that time in a leadership role, so I ended up going to prison. 6 of us went to prison, including A.D. King, because of the fact that the jails were full. And that's actually when Mrs. King called the Kennedy campaign, Patrick, and said that she was worried about Dr. King being hurt because they took Dr. King from Atlanta to Athens. And but it's interesting when you think back to it. There's a good ending to that story. I believe somebody from the Kennedy campaign, I think it was Bobby Kennedy, called the mayor of Atlanta and asked him to get us out of jail, and we were all let out of jail. By the way, the guy who attacked us, quote, attacked us in the restaurant that day was named John Sprayberry. And he attacked us with a spray gun that you use for flies. So when we went to jail, Sprayberry also went to jail. We went to prison. I never had any interaction with Sprayberry from that time until now, even though I have tried to see the relationship of him to the restaurant that has his name. But my point is that I think racism is first an attitude, as I talked about back in Anniston, Alabama. But racism also is a policy that results in behavior. We're not going to sell you an ice cream cone. Racism gets even more serious than that. We're going to put you in jail if you try to eat at this restaurant. And so racism is a policy, but it's also a behavior. And that's what we've had to struggle with. We have learned that we can change policy. And that's what we've got to figure out, how we can continue to do that with the help of people like Dr. Davine and Dr. Neighbors.
Thank you, Dr. Satcher. Patrick?
Yeah, obviously, Dan, this killing of George Floyd captured on video, of course, if it wasn't, who knows how long it would have taken. And during the same time that our country was shut down and really had no distractions, meant that we had to face this reality in a way that maybe we wouldn't have otherwise faced it. And I think I'm a person in long-term recovery. You know, one of the chief characteristics of a person who's active in their mental illness is the lack of insight as to how bad off they are. And I collectively want to use that as an analogy to our country, because I think, you know, we got woken up in the 60s. Thank God my uncle, when he saw Bull Connor, when he saw what was happening to the point of Dr. Satcher, he responded viscerally. He went on national television. He said, this is a moral cause. You know, he wrote off the South in that political statement. And but he did what was right. I think the question now is, we have a renewed kind of insight into our illness as a nation. This is a chronic illness, right? Just because we passed civil rights and voting rights and all doesn't mean it's gone away, but to the hopeful point that Dr. Satcher addressed is that you may not be able to get rid of racism in people's hearts, but you can get rid of the discrimination, active discrimination by passing laws and policies, to Dr. Neighbor's point and to Dr. Devine, that can help mitigate the impact of this on Americans. And so I just would say, we as a nation have really been in denial. That's how we say it in recovery, been in denial about the elephant in the room. And this racism has been the perennial elephant in the room. We haven't fully come to grips with it. And the George Floyd death, I think, raised it to the surface. And I think every night we see the continued deaths, I think further obviously traumatize our fellow Americans. And it's a trauma on all of us. And we have to dig down deep, which is what you do in recovery. And you have to work on how do we come out of this. And it begins with a moment of introspection on our own role in this, each of us as individuals, because we all have a personal obligation to work to change the status quo.
Thank you, Patrick. Thank you very much. And you mentioned recovery. You also mentioned trauma, which leads to our next question. It's for Dr. Dave Vines. And Dr. Dave Vines, can you briefly share what the differences are between racial trauma and vicarious trauma?
When we think about trauma, we're thinking about adverse experiences that individuals have that have a negative impact on them psychologically. When we think about it, racialized trauma, usually thinking about incidents related to racism and discrimination that sort of result in similar kinds of reactions that someone who has PTSD, post-traumatic stress disorder, has. When we think about trauma, we're thinking about the fact that this adverse event is happening directly to the individual. When we think about vicarious, we're thinking about the fact that I don't have to have an experience, but just the act of witnessing an experience results in similar forms of trauma for me. So if you go back to the trial of George to show and Darren, and we see that George Floyd experienced the trauma, but witnesses observed that incident were all on the stand, sobbing uncontrollably. They felt a sense of powerlessness, a sense of helplessness and hopelessness, and they talked about not feeling like they could, not able to do more. That's vicarious trauma.
Thank you. Great visualization for us. Thank you very much. As we go to the next question, I want to put on the parking lot the call to action for corporate America, which is a section in the report that many of you are asking about in the chat. And as we look at that call to action, we see the optics. What is it that we need corporate America to actually do? So let's put it on the parking lot when we get to the open Q&A. Now, Dr. Satcher, in this vein of talking about racial trauma and vicarious trauma, do you think we are in a unique place generationally with regards to how social media has made witnessing attacks of violence more ubiquitous?
Well, I certainly think we are in a different place than we've been before. And I think it has a lot to do with communication. And I think it's moving us in the right direction. However, we're not anywhere near the end of the road. We have a long ways to go in dealing with this problem. Several things have happened. Historically, Black colleges have this year probably received more contributions from corporations than at any time in our history. And it's because people have decided that this thing is real. You know, it's one thing to say Black lives matter and believe it without saying that Black deaths also matter. It's important that we find a way to prevent them, starting with deaths like George Floyd's. But I think the struggle that we have before us is real. And it is that we've got to find a way to act as if Black Lives Matter and to protect those lives and the lives of our children who I don't know how many deaths there were in Atlanta this past weekend, but there were far too many. And there are too many every weekend now. So we've got to find a way to protect our children and each other when it comes to lives. But I think mental health is really key here in terms of our understanding ourselves and our understanding each other and trying to figure out why it is that there is so much violence and so many people dying unnecessarily. And so I hope that's where this is leading. I really appreciate the work of Dr. Devine and Dr. Neighbors. And I hope this is leading us to a place where we have a much better understanding of what's going on in our society within our race and also between and among races.
Thank you, Dr. Satcher. As we speak about the what's in the news and social media, we see George Floyd, and that's in our minds every day. I'll take you back to the case of the Army officer, and then let's go to the man in northern Louisiana. Now let's go to Amy Cooper and the bird watcher in Central Park. And I will leave you with the power. Patrick is so good with leaving us with the provoking questions. What would have happened to that bird watcher had he not actually captured that situation on audio and video? Because she did call the police station. She did report that she's being attacked by a big Black man. And if you're law enforcement, you show up, you see him. And without that, what would have been his ending? That goes to trauma. That goes to years and decades of us saying this happened to us, but not having that technology to actually show that it did happen. So let's go to the next question. The racial justice, and Patrick, and Congressman Kennedy, excuse me, this one is for you. Can you speak to the need for accountability during inflection points like this? For example, the racial justice movement birthed in the wake of George Floyd's murder, combined with the impacts of the pandemic on marginalized communities. From each of your perspectives, how can this retrospective on the health of the Black community offer action and accountability? And what else is needed to move from dialogue to accountability? Patrick, you're always challenging us, in several meetings about, I'm hearing everything everyone is saying. What are we going to do? So.
Well, thank you, Dan. I have to say, not only vicarious trauma, generational trauma. I remember going to the floor of the House as a newly minted congressman to talk about the repeal and the assault weapons ban. And I found myself breaking down in tears in the middle of my speech when it occurred to me that it was hitting home, that I'd grown up in a household where people were constantly threatening my father's life as they had been successful in killing my uncles, and the impact that ripple effect has on the whole family. And we just are not always aware of the sustained generational trauma that our past can bring to the fore. And I certainly cannot even begin to imagine what it is like. You and I have had this conversation, Dan, where you've told me about your fears, about your child, your young man who is going out, and the worry as a parent because and who amongst us in the white community ever has that worry? So we do have to, this is on us to change this process. And I really want to say how much I respect Dr. Devines and Dr. Neighbors for really helping us elucidate what the challenge is. And now we need to create sustainable change. So there's a great deal of attention. It's the 1-year anniversary. You have the George Floyd bill, which could be a really landmark bill that comes at the time. And that's why I'm so excited that, there's great bipartisan support, Scott and Cory Booker and others, to get a really substantive bill passed. And it'll have to be multidimensional. And by the way, we're dealing with the criminal justice system, as was mentioned before. We have an education system. We have a healthcare system. each of those systems. We have a workplace system. We have a financial services system. If you look at systemic racism, it can be found in all of these systems. And that's why data matters. I think collecting data is going to be the key to elucidate that this isn't done on the anecdotal, to the points that were made earlier. Who's a racist? It's the fact that the system itself is biased that needs to be corrected. And so I would just say accountability comes with forcing people to walk the walk and not just talk the talk. And I think we're at a moment now where we've got corporate America willing to do that. We just have to keep the pressure on. And I know that corporate America accountability section is in the report and is available for folks who want to read it.
Thank you very much. Dr. Satcher, what are your thoughts in terms of what else is needed to move from dialogue to accountability?
Well, obviously we need more dialogue and we need more directed dialogue in terms of communicating across lines that have been boundaries before. And maybe some of that is beginning to happen, but not enough of it. So I think we need a new kind of communication between and amongst people in this country. So much has happened recently, and I was just thinking about what's going on in Washington and issues related to the Congress lady from Georgia, who is really shaking things up, and yet she won and is most likely to win again because she represents an attitude that's all too common in terms of people in Congress, people in this country. So we have a lot of work to do in terms of making sure that we have directed communication, that we talk more to our children and grandchildren about what they're going to face and what we need to do now to protect the future. So I think we're headed in the right direction. And I do think the most important thing, of course, is the fact that we do have the tools to communicate more clearly what's happening to us and to those around us.
Thank you. Thank you very much. Dr. Neighbors, one of the things we like to do here today is expand the conversation on the barriers to Black patient trust in medicine, particularly in mental health care. Many commentators often cite three historical atrocities, Sims, Lax, Tuskegee, to explain Black communities' distrust in healthcare systems. We saw this interpretation most recently this winter when commentators tried to explain the racial gap in trust in COVID-19 vaccinations. How does attributing distrust primarily to these historical instances ignore the everyday racism that Black communities face? And how can a culturally competent mental health care model help rebuild trust with the Black community in the mental health care space?
Yeah, thank you for that question. Well, of course, trust is a big issue. And sometimes I feel we're not so much rebuilding trust as building trust. We have to start trusting each other. So one of the things I want to make clear is, we do need to talk a lot about racism and the history of racism, because that is the big exposure that causes so much damage and trauma to Black people. On the other hand, we as Black people have to trust ourselves. And I think Congressman Kennedy hit the nail on the head when he mentioned the word introspection. So we really do, and I'm speaking now to you as a Black man who has been down. I mean, I've been knocked down flat on my back. It was really good to hear that opening song, Lean on Me, because that's basically what I learned. If I am the man down, and if I'm willing to trust myself, but also trust others, I can be the man up again. But it takes a lot of personal hard work and introspection. So we can build trust because when we start trusting in ourselves, we will start telling our stories. We will start, I think, destroying this whole idea that there's something stigmatizing about saying I have a mental health problem or I need help. There shouldn't be anything stigmatizing about that. Sometimes I refer to it as tough guy syndrome when I'm talking to the men that I'm doing research with. Everybody wants to be a tough guy, but guess what? If you have the courage to tell the truth about how you're feeling and get help from just one other person, in my opinion, that's pretty darn tough. To answer your question, though, I think if people overemphasize the history, to the neglect of what's going on currently, I do think that's a problem. I mean, we need to know our history. We need to know how we got here. But if you're going to dwell on the past, then you're going to miss what's going on right now. So I think it's a delicate balancing act. We've got to do both. I'm a psychologist by training. So at the end of the day, I understand racism is an exposure, but I'm also going to be looking for what I can do to work with each of you to get Black people to make better decisions about whom to lean on. And we can lean on each other, but when things are really bad and really serious, we definitely need to lean on the mental health professionals. Now, I know they're not all perfect, but when you look at the kind of things that Kevin Dedner is doing with Hurdle, it really gives us a lot of hope that things can change. So let me just stop by saying I mentioned earlier I have good news and bad news. So the bad news is that things haven't changed enough, but the good news is over the 30, 40 years that I've been doing this research, I have seen change. And I've seen change in the Black community. And because I am a researcher, the changes I've seen are data-driven. Stigma is not what it was in the 70s when I first started doing this work. And there's so much more awareness of what these mental health problems are. But we're not there yet. So that's the way I think of your question. Thanks.
Well, you give us hope, though, which is a part of your body of work, including the research. So thank you. Let's go to Dr. Satcher. And Dr. Satcher, you mentioned listening to Benjamin Elijah Mays from the church pews in the 1960s, challenging listeners to aim for the stars and not the ceilings of your lives, was his quote, which now is one of your favorite quotes from him is, "It must be borne in mind that the tragedy of life does not lie in not reaching your goal. The tragedy lies in having no goal to reach. It is a calamity to die with dreams. It isn't a calamity to die with dreams unfulfilled, but it is a calamity not to dream. Not failure, but low aim is sin." What do you, when you hear that and you reflect on it, when you think about the policies, the health moonshots, the focus of advocacy efforts in health equity, is America aiming high enough?
Well, I don't think we are aiming high enough. I think if you just look at our health system, and immediately obvious is the fact that we don't assure access to health care for all people. We still deal with that as, quote, a business and not a part of the service that we owe to each other. And so many other countries are doing much better than we are in terms of health, because health is seen as something that's a part of the common good. And so we haven't gotten there yet. We still deal with health as a business, and only people with a certain level of means have access to that business. So we have some work to do. I think this affects everybody, And I think mental health helps to bring it into perspective. We haven't mentioned a word that's important here, and that is stigma. Back here at Morehouse School of Medicine, we had a crash course in cultural competence when it comes to mental health. And in that crash course, the C stood for consider culture. The R stood for respect culture. The A stood for always assess culture. The S for be sensitive to culture. And H, humility. Now, obviously, Dr. Devine and neighbors have taken that much further, but that was back 20 years ago when I left government and came back here to Morehouse, and we were trying to put all of this in perspective in terms of mental health. The Surgeon General's report on mental health looked at mental health from sort of three dimensions. One was government and the role of government. And again, Patrick and the legislation put forward that's having an impact today in terms of access to mental health services was very important. But further down the line, there's a middle ground in which community becomes involved with mental health. And in the community, we have to promote mental health. We have to promote it in our families, we have to promote it in our communities. And so we have to keep struggling with that. And finally, further downstream, we have to take care of individuals. So we have people, more people, thank goodness, who are involved in providing mental health services. I'm happy to see more medical students going into psychiatry, psychology. I think in time, it's going to really make a difference. But it's been a long-term problem in terms of the stigma. Stigma interferes with our ability to recognize mental illness as a health problem that needs to be dealt with first and foremost as a health problem, but also a community health problem. And the fact that we can, in fact, create an environment that is more conducive to mental health.
Thank you, Dr. Satcher. And we want to get to, and thank you very much for the as you mentioned, be sensitive and humility and community and really addressing it as a community. I really do appreciate that. Being that
I recognize that I didn't say anything about Benjamin Mays because you had quoted him accurately.
Oh,
except that we were not in church. We were in the chapel at Morehouse College. It was like church because we were required to go every day except Saturday.
Yes,
and
yes.
Benjamin Mays spoke every Tuesday morning.
Yeah, I actually got to sit in that chapel. So thank you, Dr. Satcher. Want to ask one last question for all of you, and then we're going to open it up for questions from that are in the chat. This white paper and the discussion of the symposium offers a unique opportunity to acknowledge the psychological damage of racism and violence against Black Americans. Do you think that America is ready to listen? And what gives you that operative word, hope, for a brighter future? And that's for all of you. Dr. Neighbors?
Okay, yeah. I'll start it off. Very interested. You saved the best question for last. So I'll be very interested to hear what the other panelists say. So I think some people are ready to listen. I wish I could say everyone is ready to listen, but I just don't feel that in my heart. Here's what I think. You know, as someone who was born in the early 50s and so has, been on the planet for a while, the conversation has changed over the course of my lifetime. Because if people aren't willing to talk, then you don't have the ability to listen. So the first thing we have to do is speak up. I mean, we need to tell our stories, tell our narratives. In my opinion, this is the way we start to get rid of the stigma that Dr. Satcher just mentioned. And what gives me hope is the fact that in my personal life, the conversations have gotten deeper and richer as a result of the racial context of what's going on in our country. More people are willing to talk to each other across race. And in fact, I sometimes have to pinch myself when I walk into a meeting or talk to somebody and they do actually want to talk to me about racism, because I can remember the days when we were discouraged from even mentioning that word. So I don't think everyone's ready to listen, but I do derive a lot of hope from the change in the conversation that I've seen over the 40 years that I've been doing this kind of work.
Okay. Patrick, thank you very much, Dr. Neighbors. Do you think that America is ready to listen, and what gives you hope for a brighter future?
Well, let me say that I made the comment to some friends after George Floyd's, Derek Chauvin's conviction, that I was hopeful that it would mark a turning point for our country. And I got a lot of blowback from my friends who said to me that essentially I just didn't understand and then I was, like most Americans, just in shock about, even a week after Chauvin's trial, how many more killings there were. But I was on a panel yesterday with a leader in the police movement, in addition to some leaders in the African-American community. And I asked about cultural competence. And I could see the police representative kind of bristle. But then I said, for you, who would you prefer to talk to? One of your brother or sister officers, or someone who doesn't have an appreciation for, what it is like to put your life on the line? And I immediately they were both talking to each other from the same platform. So I think we need to do a better job at showing where these intersections take place, to show commonality of interest. Because police officers are killing themselves at record rates around the country right now and leaving the police force in droves. And, I think we need to have systemic changes, but if we can appeal to people, as you do at NAMI, on the common ground that we're all human beings, we all face challenges, and we all need each other, and we need our peers, most particularly because they understand our journey like no one else. I think we can find common ground. I'm hopeful we can.
Thank you, Patrick. And that's a part of NAMI's work, is the peer-to-peer piece. So that's very important. Dr. Satcher, Dr. Dave Vines, excuse me. Do you think that America is ready to listen, and what gives you hope for a brighter future? Dr. Dave Vines?
Here, I didn't know if Dr. Satcher was going to go first. Sorry about that. I am hopeful. I am hopeful. I've been teaching for 25 years. When I first started, I was only classes. Now, when I teach, they're very diverse classes. So I think we're creating a pipeline, and with that pipeline, we have people that are drawing on their own internal experiences and their understandings, and that is being embedded into the way we deliver counseling services. I'm also hopeful about telemental health companies like Hurdle that are catering to the specific and unique needs of African Americans and other people of color. They can come and sort of talk the experiences that they've had and have compassionate and culturally competent care. So I do think being in a new direction that is very hopeful.
Thank you, Dr. Dave Vines. Dr. Satcher?
Yeah, I think it takes a special kind of challenge for Americans to be ready to talk, and I'm not sure we're there yet. And I apologize for telling stories, but when you get to be my age, you do a lot of that. When I was a student at Morehouse, I got arrested with a young lady from Spelman, and we were on the way to jail, and she said, "Why don't we go on a hunger strike?" Well, I'm not too much of a fan of hunger, but I agreed. So we were in jail for about a week, and there was publicity all over the place about these students in jail on a hunger strike. And the business community became very concerned. I remember Delta and Coca-Cola especially calling a meeting of the business leaders in Atlanta. And in essence, they said, we cannot afford this kind of publicity. And all over the world, people are reading about students in Atlanta starving to death. Well, I don't know whether it was Delta or Coca-Cola or both who proposed that we end this segregation, this discrimination of people in terms of access to services. And the rest of the business community agreed. And they started to serve, Blacks and others. I say that because I think it does take something that touches the pocketbooks of people directly, sometimes for them to really think about what's going on in the lives of people in their communities and not just their business. And so I think about that a lot, even though I think it may be, as Dr. Nabels was saying, it may not be as relevant today as it was then, but then it was acceptable to discriminate. And I started with my 4-year-old experience because it was acceptable to discriminate against people in terms of selling things. But today we're dealing with a different kind of discrimination, maybe not as obvious, maybe not as easy to get at. But by the same token, I think the rules are the same. People respond when things touch them personally, financially and otherwise. And sooner or later, we have to figure out a way to get to that.
Thank you, Dr. Satcher. I'm going to hand it off, and let me apologize. There were a couple of questions in the chat that we weren't able to get to, but we'd like to now go to Kevin Dedner for the wrap up. And I want to thank our panelists and for the audience. So Kevin.
Well, Dan, first of all, let me just thank you for moderating this panel. You've done an awesome job this afternoon. And to all of the panelists, Dr. Satcher, Congressman Kennedy, Dr. Nabers, and Dr. Devines, you all have my deepest gratitude for your participation today. The conversation on mental health and mental health for Black Americans in particular is gaining a groundswell. At Hurdle, we are committed to raising the level of national dialogue. More importantly, we must all ask ourselves, what is our role in sustaining it? And where will the needed accountability come from to ensure the dialogue moves forward to action and policy changes as we have talked about today? From the media partners to CEOs and executives in the boardrooms of corporate America, to the therapists and the healers, some who are here today, that are on the front lines of our country's growing mental health crisis. What can each of you do to ensure this dialogue goes mainstream and accountability is had? I often say that at Hurdle, we face hard truths. The truth is, America has never aimed high enough when it comes to health and healthcare. We have one of the most discriminatory health systems in the world, and this carries true for our mental health system. Our report tells us that you must question your own assumptions about how we respond to mental health. If you're not taking into account cultural humility and competence, as we have discussed here today, or even vicarious trauma, your patient will not go served. At Hurdle, we believe that health and joy belong to everyone. This was our founding principle and remains a guiding value for the company today. Thank all of you for taking the time to be here with us today. And most importantly, to the family of George Floyd. We continue to mourn his death with you. And we thank you for his life that has sparked a global-wide movement. Thank you, Dan.
Thank you all. And we hope that you have a great close to your day and a wonderful weekend. And thank you for keeping this conversation going and the call to action that we're all invested in. We appreciate you. All the best.